Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Connor Mertens from Seattle, Washington, my co-host, and our Community Outreach Manager and Patient Advocate Extraordinaire. Today, we have a special episode. We are joined by our Government Affairs lead, Corey Greenblatt, and also by JP Summers, that you've been, JP, on our podcast before. She is our patient advocacy savant and also happens to be a chronic disease patient herself. So we've cooked up a special episode for today, and Connor, you'll also be on the hot seat.
That's right. I'm really excited. We had a really fun summer getting around to the States, and with JP, Corey, and I behind the mic, I have a feeling you're going to want to hear everything about this advocacy tour.
That's right. Lots to discuss. You guys had a busy summer, and I have a bunch of questions for the three of you. But just before we get started, Connor, what does the number 8 stand for?
You know, I usually don't know the answer, but this time I do. That is, the amount of states we've been able to go to on our GHLF road trip this summer to make sure that patients' voices are being heard at the state legislative level.
Exactly, and that's excellent work. So let's light this candle. Let's get started. So my first question is for you, Corey. You are our government affairs lead at the Global Healthy Living Foundation. So Corey, what compelled you to put together this tour? Connor, you and JP went on this tour of the states, and you obviously work on the federal level as well. But what made you decide to do this year? I know that it's been difficult to do this type of work post-pandemic. And then also comment on how was the reception from the policymakers that you visited with?
Yeah, happy to talk about that, and really happy to be here, Robert. Thanks for having me and JP on to talk. So to answer your first question, what compelled us to put together the state tour? I think it's a combination of a few things. As you mentioned, during the pandemic, we really weren't able to get out to the states in the way that we used to prior to the pandemic, where we would maybe do a couple of these trips every year. And in its place, the pandemic gave us an opportunity to continue to meet with legislators in a virtual setting, which gave us the opportunity to meet with people in more states than we had previously done. So in taking that in 2023, we said, how can we meet with more states, bring patients to these states, and get our voice and get active in more places like we used to? With more states opening up to be in person again than they previously had been, we thought that there was an opportunity for us to bring the patient voice out in a couple different key areas. And to answer your second question, what the response was from policymakers, it was overwhelmingly positive. I think one of the things that we realized through these trips was that patients walk into a door of a legislator's office, and more so than anyone else, they walk in with a net positive rating before they say a word. That's because policymakers and staffers understand the toll that it takes for patients to be there and speak to them and share their stories and what they've gone through to have to be able to share these stories. And so before a word comes out of our mouths, they're thanking the patients that we're there with just for being able to show up and share their experience. So it gives us an opportunity as a patient organization working with the patients we do to really gain a lot of key support for certain pieces of legislation across the country. And I think we were able to do that.
Corey, thank you so much. I mean, I've observed your work firsthand on the federal level. You and I work together, and I think you do a terrific job. And I'm not surprised that the reception was so overwhelmingly positive from policymakers. So my next question is for Connor, actually. Connor, besides policymakers, we were able to also communicate with some patient advocacy organizations, patient groups, and also provider groups at some points. So tell us more about what are they telling you, those groups that you interacted with in these state tours? What were the challenges that they are facing?
Yeah, thanks, Robert. I think that one of the best things that we do here and something that we, always strive to do is coalition build. And so when we get into these states, we try to find who's already on the ground, who's got their finger on the pulse of the healthcare industry in these states so we can be most effective and more voices combined can have a greater impact. One thing that I was really proud of actually with our patient groups that we started working with was how often the tool that we developed at GHLF, was used. And this was the tool that was able to demonstrate to date that there's no statistically significant change in the rates of health insurance premium increases after we see passage of state laws requiring that patients' assistance funds will have to count towards, the policyholder's deductible or out-of-pocket maximum payments. So a big focus about access challenges we heard from our colleagues in patient groups are copay accumulator adjusters, and that's something that across the board we're seeing legislation pop up all over the country to try and fight these practices. The challenge is every state has their own different legislative agenda. They have their own different schedules, and it's just always a challenge to figure out what is most needed for patients in each state and how to most effectively advocate for this type of legislation.
Thank you, Connor. So, JP, next question's for you. And you have been on this podcast before. You play a very unique role at Global Healthy Living Foundation, where you work as a patient advocacy coordinator or manager, as well as you are a patient yourself. And in your eyes, what was the reception from a patient perspective? We heard what Corey said, and I completely agree. I think when patient groups walk in, there's a great deal of credibility, but you walk in as not only a patient group representative, but also a patient. So what was the reception and in the state level when you did direct outreach?
It was a great reception. I have been in advocacy for about 8 years, and I can honestly say that this was the first time of doing meetings in a row that I noticed that we were getting asked question after question. I could see that the aide or the representative was writing down notes. And to me as a patient, that means they're invested. When they ask those questions, when they're taking notes, they are invested not only in your time, but you. And I just was so amazed at, again, walking in, like Corey was saying, we're walking in and they were thanking us for being there. And then again, after sharing our stories, they were asking questions. And I just felt that I belonged there, that we weren't just another appointment, that we were actually worth their time.
JP, that for me is music to my ears, because that's one of the things that we've strived for, right, for decades, is to get an actual patient voice heard, not only those that represent patients. So, Corey, I'm going to come back to you. Just like many of us at Global Healthy Living Foundation, the list of issues that you cover is unbelievable. There's a lot of policy issues that we work on and try to discuss these topics with policymakers and other organizations and other individuals. What would you say, in your opinion, was the main policy topics that repeatedly came on in these discussions with the policymakers or anyone else that you were working with on the state level in these tours?
Yeah, and Robert, you're flattering me. I'm blushing right behind here. But I think some of the key issues that we talk about a lot are, and I'm sure you mention it, and I know you mention it many times on your podcast, are copay accumulator adjusters, copay assistance. Copay accumulator adjuster bans are probably the most common bill that we are advocating for at the state level right now, in part because we feel we are coming at this with expert evidence based on our organization's reporting and your own reporting and our accumulator tool, that we're able to talk about these laws in a way that many other patient groups can't. And when we are able to bring patients like JP and many of the other patients we worked with as well to these meetings and talk about this issue, there is a palpable feeling in the room, and there is a true effect when we're able to actually get the impact of these accumulators through to staff members and what the outcomes of the research has kind of shown to prove that these laws should be passed. Beyond copay accumulator adjuster laws, many of the bills fit into PBM, pharmacy benefit manager transparency laws. So things like share the savings laws or rebate reforms, ways that would decrease costs for patients while also increasing transparency on the PBM industry, are things that we've been very conscious of as well through our work, both as an individual organization and with many of our coalition partners as well. I could go on and on about the issues, but really those were kind of our key focuses this year.
Thanks, Corey. I mean, you're aware of this, but you've probably already seen it this morning. I got a note about Senate Finance introduced federal legislation legislation regarding delinking fees that the PBMs charge from the retail price of the medicines. We've talked about this repeatedly on our podcast, how it's a misaligned incentive because it basically promotes utilization of more expensive medicines. And this is going to be the first step, I believe, to doing a lot of that PBM transparency and PBM work that you've spearheaded for GHLF in the state level. So kudos to you. Good work. So JP, I'm going to come back to you for the next question. You obviously work through GHLF to help patients every day, patients such as yourself. And, I know that you've been active in a couple of states minimum that I know of. Wisconsin, you testified in that state regarding banning accumulators. And in Texas, you wrote an opinion editorial that was picked up by multiple channels actually in the state level. Can you give us another specific example that you've worked with, or the same, or elaborate on the work you did in Wisconsin and Texas as a GHLF representative and as a patient representative?
So when I go to testify or when I'm writing an article, doing the advocacy days, I feel empowered. I feel like I have some control over my health, even though most of the times my symptoms are debilitating. Just having a voice. And again, whether it's through written testimonial, in person, meeting with different representatives from each state that I live in, I still feel that it's important to share my story and raise awareness. But I know that the patients that come with us, the patients that participate on these advocacy days, I know they feel the same. We have conversations in between meetings, even before we prep. We do, kind of go over their stories and we speak with them. And I hear all the time, whether it's just through passing when we're going from meeting to meeting, or I get a text or email just saying, thank you for allowing me to share my story. And again, a lot of them are chronically ill and they're going through the same thing I am. They're having good days, they're having bad days, and they just feel that their condition has taken away so much from them. But to be able to speak about your situation, to be able to share your experiences, I know it's very empowering. And they all feel confident again in themselves. And that's something that most people will think, that maybe sharing your story can be painful at times, but really, to be honest, I find it so empowering. I feel better mentally and emotionally. Maybe not physically, because I'm not, again, may not be feeling well in that way, but just to have that feeling that I just took a piece of my former life back because I shared my story, it's just a wonderful feeling. And I know that those patients feel it because they've told me several times.
That's terrific. We're so happy to have you and also discuss this topic with you. So Connor, last question for you. You talk to a lot of patient groups, and Corey and JP talked about some of the policy topics that they've covered in their discussions. Anything else came up in your work in the state level with any other policy issue that was sort of hot and heavy that you were dealing with?
When we talk to patients, there's a lot of other issues besides the ones that we've been able to talk about today. Some of those ones are just high healthcare costs, expensive medications, which we cover extensively on this show, and actually our last episode, go check it out, was about, the new drug pricing paradigm that we're on the cusp of. And that's just a common everyday thing that folks living with chronic disease have to deal with, are high and expensive medication costs, high healthcare costs, out-of-pocket expenses. Another thing that we hear about is these soft costs, the ones that may not necessarily be able to be covered by insurance, such as transportation expenses or home modifications or caregiver expenses, lost wages. There's a lot of ways that chronic disease impacts patients outside of what we're working on at the legislative level. And then the other one that's just very topical is we've been seeing a rolling back of accessibility and accommodations that rolled out during COVID that really benefited a lot of folks living with chronic disease. It made getting back and into work a lot easier. And so, there's a lot of things that are constantly facing patients. And here at GHLF, we're always trying to track those down and do the best that we can to help patients not have to experience them. Right, Robert?
Thank you. Thank you, Connor. Yes, absolutely. And I want to give each one of you one last opportunity to give us one takeaway you had from the tours that you've done in the state level. So, Connor, let's start with you, actually, and give us one takeaway, quick.
Great. Yeah. Nice to share the spotlight with some other folks now. Yeah, for me, what was really impactful was the amount of times we'd walk into a legislative office with one of our patient advocates and, working alongside our patient advocates, and then hearing from lawmakers, hearing from their aides that this was the first time they'd spoken to a patient about these issues. And that's a double-edged sword where it's disappointing that the lawmakers are not hearing directly from patients as often as they should and how these laws can impact their lives. But it does give us a sense of pride that we're making sure that wherever decisions are being made about patients, that their voices are being raised and they're being heard. And I'm sure JP will talk more about it, but just the pride that we have in being able to validate our patient community in these places is really rewarding, and I look forward to continuing to do it with the great gang that we have on this podcast today.
Excellent. Let's go to you, JP, then. What do you think? What is your one takeaway from these meetings?
I am so glad that we are doing these advocacy days because we are getting the opportunity to visit these different capitals and put ourselves out there as an organization, but also bringing patients. And again, we are investing in ourselves and we are helping to raise awareness. And it's just a great thing. It's a great thing that we are doing. Again, I feel very fortunate to be able to attend these meetings and to be able to speak with the patients. They are equally as excited as I am to be able to do these meetings in person.
Thank you, JP. And Corey, one last take?
One of the biggest takeaways from this is that PBMs are now a known actor in the healthcare industry. We don't spend our first 10 minutes of our meetings anymore explaining what role pharmacy benefit managers play in drug pricing and formulary exclusions and all of these things. Staff members, legislators know them. For the most part, they understand that these are for-profit companies that are making decisions that continue to make them profits and not necessarily benefit patients. And so we're able to spend the rest of the meeting focusing on the issue at hand, not necessarily the actors that are taking part in these issues.
Well, Corey, I have one thing to say. Amen. Because it's taken decades, correct? I mean, you and I have been at this for a long time. So.
Oh yeah, it's really nice that now we can walk into these meetings and we can kind of say, okay, so here's PBMs, and immediately see the staff members go, okay, bad guys, got it.
So with that said, I want to thank all three of you for joining us, Connor and I, on this podcast.
Well, Robert, just because we got some new friends on the podcast today doesn't mean we're changing things up. Let's make sure you get the last word in there. What's your biggest takeaway from hearing about the adventures of GHLF on the road?
Yeah, the GHLF road trip. That's interesting. So I would say the one big takeaway I have is that, at GHLF, we do extraordinary amount of research, both on clinical research and also policy and economic research. But without being able to communicate those results, those findings effectively, especially with policymakers, patients, and providers, there's no point of doing that work. And what my takeaway is that the work you all do, the three of you did over the summer, visiting with policymakers, patients, providers, anybody who is interested in these topics, is that you gave us a venue to be able to share the exciting work that we're doing at GHLF and be able to promote the solutions that we provide that improve access for patients. So kudos to all three of you. Thank you for doing this. And, as always, Connor, you and I will be back on the next podcast, but I want to specifically thank JP and Corey for joining us today.
You're welcome back anytime, folks. Thanks for joining us. Thank you to our listeners. We've got plenty more coming your way this season, so don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening so you never miss an episode. If you have a second, help spread the word by rating our podcast, writing one of those positive reviews, and sharing with your friends and family. It'll help more people like you find us.
If you have any questions, comments, thoughts, suggestions, anything, you can send us an email at podcasts@ghlf.org. And who knows, Connor and I go through those every day, every week, and we may include some of those topics in our next podcast or try to answer some of your questions that you may have.
And before you go, make sure to take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of those GHLF podcasts at ghlf.org/listen. Well, thanks again to JP and Corey for joining us. And as always, he's Dr. Robert Popovian.
And he's Connor Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.